Okay, this is a little video for pages 102 and 103 in this white book here, in this book 102, 103 for all the ESL 450 students. I'm Dr. Combs. Before we start, I'd like to show you a few things you should know, because the reading is about a hospital. So these are things you might encounter in a hospital. All right, here's alcohol. This is not the kind you drink. It's rubbing alcohol or isopropyl alcohol. Then you see the doctor. He might use a tongue depressor. I don't know if they use these. Oops, excuse me. Upside down, backwards. Tongue depressor. That's your tongue. That's a tongue depressor. This is a really big one. It's not really that big. That's too big. Then I don't know, your doctor might have some tweezers. If he has to pull something like a hair out of your ear or something, here's tweezers. You probably have these at home for, what do you call those things? Thorns or something stuck in your finger or hair. Of course, when you go to the hospital or after you go, you'll get some pills. Let me stand up to show you the pills. There's pills. That's ibuprofen, but those are just some pills. Then they give you a shot. You'll have to use a syringe. Here's the syringe right here. This one has no needle, so it won't work. And you go give you a shot. Of course, if you have a fever, they will have to use a thermometer. I don't know what happened to my thermometer. It fell on the ground. Oh, here it is, right here. Here is my thermometer in my pocket. But in the hospital, usually they have something that goes zip, and there, you're done taking your temperature with a thermometer. If the doctor checks your reflexes, they don't do this too much anymore, but he might take a hammer like this and check your knee. Bonk. Ah! Probably not. And all doctors wear something like this around their neck. This is a stethoscope to check your heart rate or to clean the toilet. I'm not sure which. That's called a stethoscope. Big word. To check your heart. And then, every once in a while, a doctor will come out of the operating room where he'll need some help, an extra hand. And here's an extra hand. If you, sorry. We don't need that. Okay. Now, we will look at page 102. The first part you will do is look at the picture right there. This is 102. Let me get it up close so you can see that number, 102. See? There. And we're going to do this page and 103. Okay? And you're going to ask some questions right here on 102. Look at the picture. Answer the questions. Who are these people? What are they doing? Okay? So I'm going to read this letter of recommendation, number 2. Read the letter of recommendation. Listen and read again. Dear Mr. O'Hara, I'm happy to write this letter of recommendation for Marco Alba. Marco started working at Valley Hospital as an orderly in 2007. He takes patients from their rooms to the lab, delivers x-rays, and takes flowers and mail to patients. Of course, right here we have a patient. This is a patient. He also delivers linens and supplies. He is an excellent worker, and his co-workers like him very much. All right, now we're at the second paragraph. Right here, second paragraph. Right there. We are sorry to lose Marco. He wants to go to school and needs to work part-time, but we don't have a part-time job for him right now. I recommend Marco very highly. Please contact me for more information. Sincerely, Suzanne Briggs. Suzanne Briggs, Human Resource Assistant. Okay? Very good. So this is a letter of recommendation. This is what you get when you want to go get a job someplace else. And not, that your employer gives you a letter of recommendation saying, this guy's good. Please hire him. Okay? That's what this is all about. Okay? So I'm going to have you guys do the before you read, the read, 1, 2, 3. I can think you can do all this. 1, 2, 3, 4. All of these. And yeah, I think you can do the whole thing. You cannot do this for B with a partner. You can do it on a piece of paper. Anyway, email me your answers. Send them in an email. Okay, you have my email address. Thanks. And take good care of your health, for heaven's sake, because you don't want to end up like this guy. Okay? Thank you.